Because malaria is so endemic in like third world countries, it is quite difficult to treat and diagnose, but we do have some techniques that are usable in those areas. So we have microscopy of a thin or thick blood film. This is taking a blood sample from a patient, like you could do like a little pinprick on the finger, and then spreading it out on a slide. If it's a thin blood film, then it's a really thin swipe of blood, so it's like very, very small, like one red blood cell thick, and it helps us identify the species and parasite forms. But what we tend to use is a thick blood film because it's faster and easier to just swipe some blood regardless of thickness, and it allows us to detect if an infection is present and to estimate the parasitemia. Another way is through rapid diagnostic tests, such as, which everyone will be familiar with due to the lateral flows with COVID. This is an antigen detection, and it's a great technique to use if reliable tests aren't available. Reliable tests are molecular tests such as a PCR. These can actually detect the parasite's nucleic acid and are very species specific.